Yesterday we had this very interesting international session. We were tackling treatment access and diagnostic access to low and middle income countries around the world. This was an international panel with physicians from Africa, Nigeria, from Middle East, from Taiwan, and from South America, where I belong. I'm from Argentina, and there was also Carlos Chiatone from Brazil. We more or less have the same difficulties accessing these novel therapies because of increasing cost of medicines, and we believe we need to work together with patients associations, with pharma, key opinion leaders, and with the government to establish policies where the aim should be to have all the CLL and lymphoma patients getting the best treatment options, but not only treatment options, but the best diagnosis possible. We are lagging behind not only in treatment options, but in diagnostic studies as pathology, specialized pathologists, flow cytometry, molecular studies. So a lot of work to be done. I represent Latin America. Latin America is a cluster of more than 33 countries, actually, with more than 600 million people living in this region. And some is about 10% of the worldwide population. And we more or less share many things in common, like the language. Most of the countries are Spanish-speaking, but we share the same difficulties accessing state-of-the-art treatments for CLL and for lymphoma as well. And one of the ways we've tackled this issue has been through clinical trials. We're building up our clinical trials capacity in our region, and we're engaging in many clinical trials sponsored by the industry, where even the standard of care is above the standard of care arm is above our standard of care in our countries. So it's a win-and-win situation where we get to use novel therapies, directed oral therapies, but also bispecific antibodies and even CAR T cells. That is, we are a region where CAR Ts, the only country who has used CAR Ts commercially is Brazil, but all the other countries were lagging behind. So a lot to be done. We're very enthusiastic about getting better access to our patients in terms of diagnosis and treatment. And we believe if we continue with this type of sessions, where we are tackling down the access problem worldwide, and not only in central countries, but in low and middle income countries, we'll have a better world and a better opportunities for lymphoma and CLL patients worldwide. I think it's very important to disseminate these issues around the world. So thank you very much.